Hello, everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. And most of you know, Mondays and Fridays, 1 p.m. Eastern Time, we have Facebook Live, bringing specialists, parents, researchers from all over Canada, and sometimes from all over the world to share with us their expertise, their insights, their experiences during this time of the pandemic. As many in-person appointments have been canceled, a lot of appointments are being online. So there's a lot of questions and concerns from parents that we're trying to address here. And please feel free to send us your suggestions, your recommendations that we're going to try to address. All past videos have been recorded and you can find them on the CanadianPreemies.org. We have a variety of topics from breastfeeding to managing care at home, which is our topic from today. But we have also talked to neurologists and see what's happening in hospitals and in NICUs across Canada. And today we are going to talk about managing the care of your baby at home if your baby has complex care needs. And to talk about that, I have here with me Brenda Agnew, who is the proud mother of two boys, Chase and McLean. Her youngest son, McLean, was born at 29 weeks due to twin-to-twin transfusion and is a surviving identical twin. He has severe cerebral palsy and profound hearing loss. Since his diagnosis, Brenda has been tirelessly advocating for better care, better systems and programs for children with special needs. She's a client liaison for Gluckenstein's lawyers, a school board trustee at the Halton Catholic District School Board, and a consultant with Chronically Simple. She's also the creator and moderator of PAL, the Parent Advocacy Link, which is an online Facebook group of over 2,000 special needs parents. Brenda, thank you so much for joining us here today. I know you are super busy and this is only half of your bio because you are involved in so many things here in Canada. So thank you.
Yeah, thank you for having me. Any chance I have to chat with you and everybody is a good thing. It's a good reason to be busy. So I'm happy to be here. Thank you.
Oh, thank you, Brenda. So I wanted to obviously I know your story, but most of people don't know your story here on this group. And I would like you to start by sharing a little bit how you end up in the NICU with your twins.
Yeah, for sure. So, again, my story, Fabi, and it's not dissimilar to your story, which is another thing that always brings you and I back together. But I was expecting identical twin boys. My older son was 19 months old and was about 29 weeks and 5 days pregnant with the twins. They were identical, as I said, and started to realize a bit of a decrease in movement. And thought, okay, well, you know what, they're getting bigger and, this is happening. And so I headed off to our local hospital after finishing a full day of work, of course, and headed to the hospital. And unfortunately, at that point, they had realized that one of my twins, Braden, had passed away from an acute condition known as twin-to-twin transfusion. And it's a condition that can be chronic or acute. Chronically, they'll, monitor you. But acutely, you have no idea it's acute. So we had no idea that we were even at risk for it. On the Monday, everything looked great at our ultrasound. And by Thursday, we had lost a child. And so McLean had to be delivered to save his life. So with twin-to-twin transfusion, one twin receives too much blood, one doesn't receive enough. So McLean was the donor twin and he was in some serious, he was in a serious condition. And so a decision was made to deliver him at 29 weeks and 5 days. And then he was sent to our local hospital, which had a level 3 nursery. And that is where our NICU journey began. Like everybody else, I showed up at the hospital wearing what I was wearing. I had my little purse with me. And then all of a sudden it was an emergency C-section. And the last thing, I sort of saw was them taking him out in the incubator and saying, we're going to take him here. Here's a few things for you to read. And we'll update you tomorrow. And then that started an almost 4-month journey with him in the NICU.
So during that time in the NICU, I bet that you were looking for information because I know how you are eager to learn everything that you possibly can. But were you aware the risk of any developmental delays or new diagnosis down the road once you start to getting that stage, okay, now we're time to get home. Is my baby going home on oxygen? How that transition happened for you?
Yeah. So it's a great question, because initially McLean was doing well and then he wasn't doing well. And, just for people that are watching, I just think it's important to note that, the interesting part about McLean is that while he was a preemie, the majority of the issues he had early on, they were prematurely related, right? He had the apneas and bradycardias, he had trouble regulating his temperature. He had trouble regulating, his kidneys. He needed, all those sorts of things. But he sort of grew out of those. And the reason that McLean continued to have issues in the NICU is that he had a condition known as chronicterus, which we didn't know at the time, but it's actually caused by untreated jaundice. And so he had developed jaundice in the NICU, and for a whole variety of reasons was not treated. And so it was an interesting time, because on paper, nobody could figure out why he continued to have the issues that he had. They just weren't making sense from a typical preemie perspective. But having said all of that, we were discharged really with no major follow-up. So I think because McLean was a premature infant, he was a surviving twin. He'd been through a lot at the beginning. We had sort of heard he's going to take a little while to catch up on his milestones. He had no brain bleeds. Ultrasounds looked good. Everything else looked good. So, from their perspective, it was, grow, feed, all those sorts of things. His breathing would eventually, he did have chronic lung disease because he was ventilated for a while. So all of those things would sort of self-resolve. So when we were discharged, we had really the only follow-up he had that was on his discharge papers was for eyes, because of retinopathy of prematurity, right? He was at risk for that because he was on oxygen quite a bit. Really that was, and his hearing, because he had failed his hearing tests in the NICU. So those are what he was referred to. There was never a discussion about cerebral palsy or anything like that. When we left, we knew we'd have some feeding issues. He was supposed to come home on oxygen, but the day before we were discharged, the little guy pulled it out of his nose, and they said, give him 24 hours to figure this out. So he did come home on a pulse ox, but didn't come home on oxygen. So, Fabi, it's one of those things where, I felt like we kind of had dodged a bullet a little bit. And I thought, let's get him home. Let's, get him doing some things. And maybe we've come out of this unscathed. We didn't really have a strong indication that there would be anything coming down the wire for him.
So when that started for you, like we start going to appointments and you start hearing here and there the possibility of having delay. So how was that piece for you? How did you manage that? But also how did you manage having another child at home? Because a lot of parents, like the preemie is either the second or the third, and you have to manage that extra piece in our lives that is, I find it very challenging.
Yeah. And it was, even right in the NICU, I remember when, I was very adamant about being there. Obviously, like a lot of parents, I wanted to be there for every round. I wanted to be there for every discussion. I didn't want them to drop his feeds because I wanted to be there to actually try to breastfeed him or feed him. I didn't want him just getting it NG'd. And so I was at the hospital a lot, but then, I have this at that point, 22-month-old home or 23-month-old at home. And so, I remember I would come home, tuck him into bed, drive back to the hospital, so it was trying to manage it while, McLean was in the NICU, thinking that it would be great once he came home because we wouldn't have to worry about that anymore. And then of course, he came home and right away was referred to a preemie pathway through our Halton region program because he was a premature infant. And so that set the stage for, OT and PT to sort of coming into the home. But then in the meantime, we were chasing down a diagnosis of hearing loss. He had been connected with a developmental pediatrician. We had to follow up on retinopathy of prematurity. We had to follow up on respiratory issues. We had to follow up on GI issues. And so, we didn't expect any of that. And, it's tough, Fabi, because you've been there, but, there were a lot of appointments. It was a lot of appointments. It was a lot of management. I'm bringing my 2-year-old with me everywhere. It was really challenging, and we're trying to enjoy McLean being home. We're trying to grieve for, what we've lost. And now we are barraged with all of these appointments, and you're waiting with bated breath after every appointment for a diagnosis. What's wrong? Is everything okay? Is he going to be cleared? You know, and I'd say that was consistent for the first 2 years. That didn't let up.
So how did you manage that schedule? Because I know, like, you go from needing one appointment with the, you know, just one clinic, and then all of a sudden you have that one, and like you keep adding all those appointments to your calendar. So how did you manage that schedule at home, having another child at home?
Yeah, I mean, I'd love to say that I had a beautiful science to it. But you know, I didn't. Sometimes I thought I did. I had everything in a row. Everything had a folder. Everything had a binder. Everything was color coded. You know, everything was things like that. You know, we tried a lot to sort of say, if we were going to spend the day at the hospital, could we try to get all of those appointments in at once? We utilized a lot of friends and family. I mean, my husband was working full time. So it wasn't like I could constantly say to him, can you take the day off to come to appointments? We needed to have that income. And so a lot of it was, you know, who can I send Chase to today? Who can he go and spend time with? But, you know, I didn't want to miss any of them. I didn't want to, in that first 2 years, I didn't want to miss an OT appointment. I didn't want to miss a PT appointment. I was fully engaged in researching everything about brain plasticity and neuroplasticity and, you know, trying to help him and try to figure things out. And so, you know, I probably was putting more on myself than I needed to as well, because I was adding to those appointments by also seeking out other specialists and other therapists. But, you know, we had a big calendar and we really tried to work with our teams. I really tried to say to our teams, listen, I need you to help me here. You know, can we try to make the appointments together? Can we try to do it? But it didn't always work like that. You know, I remember going to the same facility 3 times differently in 1 week. You know, it was tough.
Absolutely.
Yeah, and you're logging the big binders with you, right? The whole time.
Brenda, but tell me about your expectations, because you left the NICU thinking that, okay, this is done, it's over, now let's check the hearing. And all of a sudden you become this parent with all this medical complexity in your house. So how did you manage that for yourself as a mom?
You know, I'd love to say, Fabi, that I managed it really well, but I didn't. You know, I had a really tough time. I'm a type A personality. I'm a control freak. If I read enough about it, if I research enough about it, we can fix this. And it was really tough. It was, you know, my expectation, I mean, my hope was that everything was okay, but I could see the signs that things were not okay. And so, you know, you're in I don't want to say panic mode, but I probably didn't deal with it as well as I could have. A lot of stuff I did was reactive. It was panic. It was, you know, how do we fix this? What can I read about this? I mean, I remember, you know, I won't touch a book now that's about anything to do with diagnoses or medical complexity, because my nightstand was like this. So, you know, it was trying to manage, but I did manage my expectations well. I did this a lot, like, please let this be okay. But you know, I didn't. And when he got hit with his hearing loss, you and I have talked about this before, you know, that came out of left field. So when he was diagnosed as severely profoundly deaf, that was something I was never expecting. And so that took us down a whole other rabbit hole that I didn't think we'd have to manage. You worry about the CP thing in the back of your mind, but the hearing loss we never anticipated. And that was another big spiral. So I kind of learned to not expect anything and really just to, I couldn't anticipate what was going to come next anymore. I really couldn't. Yeah, it was tough.
So we talk about the expectation, you're not managing too well. And I think this leads to a very important topic, which is our mental health, because I don't feel that we talk about that enough, or you don't handle that well. No. Because there's so much stigma still around it. And I feel that the first year after the NICU, you're still in this fight or flight mode that is very hard to deal with the emotions. Yeah. So how did you cope with your mental health to still keep, you know, somewhat strong, because you have 2 kids to look after, but you still had to look after yourself? Yeah.
It's a really good point, Fabi. And, you know, and I've been very open for all of these years about my own personal struggles with mental health. You know, they started, you know, I had a bit of postpartum after Chase. It was easily resolved. But when I had McLean, it was a completely different ballgame, right? Again, we're talking about, you know, grieving the loss, you know, of a stillborn child that was almost full term. anticipating, expecting to have, 3 boys under the age of 3, realizing that's not going to happen, dealing with the trauma of the NICU, and now dealing with the fact that I may have a child that's going to have some extraordinary needs, on my hands. And I have struggled with anxiety and depression and panic attacks since McLean has been born. And I'd love to say that 12 years later, I don't anymore, but I do. And, a lot of it is situational, but really for me, it was reaching out. It was, I've never been afraid to seek out help for medication. I have done a lot of therapy. I've connected with parents, I've connected with peers, because I needed to know that I needed validation for how I was feeling. I needed someone to say, you know what? Yeah, it's okay that you're depressed about this. And it's okay that you're having a panic attack, or that you're anxious or worried about this, because that's a real feeling. And, Fabi, it's something, I don't want to equate this to a one-off event that you can, you've had a traumatic car accident, or unfortunately you've lost a loved one. Over time, you find ways to get past that. This is every day. This is every day. You don't have a way to close that door and walk away from that. So it's still a process. But, it's really important when, the first 2 years, I wasn't me. My marriage suffered, everything. I mean, I went back to work, I had a breakdown. I had to leave work because I took too much on, and I wasn't taking care of myself as much as I should have been, even though I thought I was. So mental health, man, if we could do a better job of supporting those parents right off the get-go in the NICU, in the transition, and then check in with them. Because just because it's a year or 2 years or 3 years or 5 years down the road, I can't walk in now and have the smell of soap in the hospital, right?
Absolutely. You never know where the triggers are going to come from.
Never. And so it really is an important point. And I felt that I spent so much time talking about McLean's diagnosis and talking about our journey. And I remember someone saying to me at one point, Brenda, like, when are you going to grieve your son you've lost? When are you going to acknowledge that has happened? Because there wasn't time for that. And where that came in? That came 3 or 4 years down the road when, I was dealing with that. So, mental health, we can't be there for them if we're not there for ourselves. Therapies, interventions, medications, yoga, whatever it is. And if you can't figure it out, find someone to help you figure it out. And, but like I said, I still deal with it to this day, and I'm not ashamed of it. It's part of who I am. And it's part of, I allow myself to have the days where I can't function, and then I make up for it, on the other days. So, it's a real part of who I am, right? It's a real part of my story.
Absolutely, Brenda. Thank you so much for sharing this, because I know how hard it is for a lot of people to open up and really seek that help. And sometimes, it's hard to get help. It depends where you live or how much access you have to resources. But I think it starts from peer support is such a great point, because for me, when my son was first diagnosed with CP, I had you as my mentor, somebody connect us. And I was so, very touched by your story, because our stories are so similar. And, having another child at home and having losing a twin. So there's a lot of similarities in our story. But what made me, really get up and continue is not what you said to me, because I remember bombarding with questions about logistics and how life looks like. How do you do on a daily basis with your son? But it was the fact that you were still standing, and you were just bubble of energy, and you really supported me that point when I was really low and not knowing what the future was holding for us. And I think support is such an important piece. And from obviously getting from one peer, you can open up and maybe get further support if you need it. And I think there is no shame in asking for support and help when we need it the most.
Yeah, it's really true. I mean, for the first 2 years, Fabi, I had no one. I didn't. I had no one who understood my story. I had nobody who, nobody. I didn't know anybody that had a child with cerebral palsy. I didn't know anyone who'd been through our situation. I didn't. And when I found the lifeline of other parents, it's a game changer. It's a game changer to talk to someone about how you're feeling, to ask someone their opinion on something, to share your concerns and your worries, to have someone problem solve with you, to have someone say, you know what, I get it. And I get it because I live it. Power in that. And much of where I am now is because of other parents who have given me tips and tricks of the trade, or who have let me, get off my chest, or supported me when I needed it. I wouldn't be here without that. I'm done. I can tell you that right now.
Absolutely. So I want to switch gears a little bit, because besides of all the struggles that we share with us, you still found the strength and you felt empowered enough to start advocating not only for McLean, but for the whole system. So how did you get started? Where did you find there was a gap that you need to step in and say, I need to do this?
So, I think, sort of along the way, you just sort of identify those, the gaps that are there. I remember when things would come up and I thought, I can't be the first person that has gone through this, or we can't be the first family. My son can't be the first person. This is not possible. And you realize, sadly, that you're not the first. And so right away, you're like, there's a gap that exists. Why is this still happening? Or why is this conversation not happening? Or why is this? And, as I get older, I pick and choose those a little bit more. But, when it first happened, I felt like, again, because I didn't know anyone else that had been through it, I felt like, I just needed to be the voice for, if I was going to do it if I noticed something that was not happening that needed to happen for McLean, it's not about McLean at that point. It's not about him. It's about everybody else. So there's a lot of work that I do, as research committees or things that I sit on, they will never impact McLean. They'll never have an impact on him. Even when I look at things from a school board perspective for younger students, he'll never be back in kindergarten. He'll never be back in, but there was a gap that was there that needed to be addressed. And so hopefully the next parent that goes down the road, they may still have the same problem, but maybe one won't. And if one parent can have an easier go of it, there's people that set the stage for me before I came down. I'm going to set the stage for them. And so, again, that's where I've sort of identified, along the way, there's gaps in healthcare, there's gaps in the school system, there's gaps in funding, there's gaps in health. There's gaps along the way. And so, it's sort of identifying what's really important for us at that time. And, is this something that we can, and there's a sense to, Fabi, it's self-serving. There's a sense of walking away and knowing that you've turned a not so great situation into something that might be beneficial for somebody else. And that's what keeps you going, right? So when I get the phone call and someone says, Brenda, can you help me with this? And I'm like, and then I say, yeah, of course I'll figure out how to do that, because I also ask the same of other people. So, I think the gaps, I didn't have to find them. They were there. And then it was, how can I do something to fill this gap and make those connections?
Absolutely. It's something that you do so well. I've seen you in action and participate in a lot of research studies and committees. And this is such an incredible work. And I think it does come from the challenge that we face, and how can you make something good out of it to support others along the way. And I think that is the work that I see today in our community of premature parents all over the world, starting parent organization like CPBF, and really supporting others coming after us, because we know how hard it is to be there, and how can we help to fill up that gap. It's never going to be perfect, but how can we make somebody else's journey a little better?
Yeah.
So I think that is the purpose.
Fabi. Yeah, that's it. It's never going to be perfect. And I say that to people. I say, if we can get 80% of the way there, if we can get 70% of the way, if we are better than we were yesterday, that's a win, because each person's going to contribute along the way, and we might get there 100%. So, let's just try to make the contribution and see where we get with it. As long as your mental health isn't compromised in the meantime.
It's true. So let's talk about this beautiful community that you created online, the Parent Advocacy Link, that I'm so happy to be part of that group, because the days that I'm really down, that's where I go to read stories, to find support, and to find a shoulder that I can cry on, even though most of us, we only know each other from that group online. We never met in person, but it's such a great way to know people are there for you, and they understand your struggles, because it's not the same as talking to somebody who haven't walked in your shoes, because they can relate.
Yeah. So it's true. I mean, a lot of people in the community, and even the preemie community, they might be aware of a mom named Dana Giel, and she has triplets with cerebral palsy. And when Dana and I met each other, she's very similar to you and I. And that's what we talked about a lot, was we needed a platform. We needed an opportunity for families to connect with one another. And how would we create that? And so from that became PAL. And, you know, we have almost 3,000 members in that group now. And, you know, again, it was parents needed a safe place to talk. But what was really intriguing about it, Fabi, is that we didn't want it to be siloed. We didn't want it to be a CP group and then an autism group and then a Down syndrome group. And then we were like, you know what, because at the end of the day, if you're looking for AFO socks, doesn't matter what your diagnosis is. If you're looking for boots to fit over the AFOs, if you're talking about spec ed issues, if you're talking about funding, if you're talking about managing and family and therapists and interventions, those run the gamut. So we wanted to break down silos. We wanted to bring families together. There's always a common link, and just give parents a chance to be able to vent, cry, ask for advice. And it is one of the things I'm the most proud of. It has been a lifesaver for me. Like you know, I could ask all of my friends something and I go on PAL and I say it and I instantly feel like, whoa, this group gets it. They get me. There's practical advice. It has been a game changer. And what's really great about it is it's also provide, with the permission of members, it's provided a platform to share their collective voices. So I'll get a call from, you know, Holland Bloorview that will say, Brenda, you know, we're looking for feedback on this report or this initiative. Would you go to PAL? So PAL is now known in a number of different research communities as being a go-to resource because of the breadth and depth of knowledge and experience in that group. And I'm really proud of that, because it means someone's listening to our parents, and it means we're valued. You know, they're looking at us as a valuable resource for them. And that's, you know, having a voice is so important. So
absolutely
it's amazing. I love it. I'm proud of it.
Yeah, it is an incredible group, but I want to point out to all the NICU parents who are either in the hospital or still the first year home, our peer support group, the Canadian Preemie Parent Support Network, is exactly the same idea of PAL, but for parents who are in the NICU, off the NICU for a few years, not necessarily a diagnosis of anything, but we share that NICU experience. And just like in PAL, researchers come to us to get our voices, and I think that is very important for parents to get engaged in research to really better outcomes for future generations.
So true.
And those groups have is a multifunction. It is a peer support, it is a share of resources, but also you're doing amazing work with research with parents, because our voices are truly valued these days.
Absolutely. And I've seen the work that you've done, and I've seen the voice at the table, and it is very powerful.
Absolutely. So Brenda, there's something else that we worked on for a couple of years and was officially launched last year. And I'm so happy that came to reality, especially now in this pandemic, to have our records online. So talk to us about Chronically Simple and how it's been helping families with medical needs.
Yeah, so Chronically Simple is an app that was developed. So my friend Christy, our kids are good friends. Her son Keegan and McLean are best buddies. Keegan is neurotypical, but Christy has Ehlers-Danlos syndrome. So she deals with a chronic illness. And so we always used to talk over breakfast about all the binders and all the appointments, track all of those things. And we had said there has to be a better way. And so, Christy really took that and ran forward with it and developed an application that allows caregivers and patients to manage all of their paperwork, their appointments, their schedules, their prescriptions, and everything, and have it, at their fingertips or on the computer. And so that was the whole goal behind Chronically Simple. Was she approached things from a patient perspective, and then I would say, as a caregiver, I would love to have this and this in it. And so really, it's been developed for caregivers and patients by caregivers and patients, and it allows people to connect everything. You can upload your records. Connect that record with an appointment, connect that appointment with your pharmaceutical, your pharmacy. And then it also allows you to build a team, and it allows outside people to have access to it. So, if I wanted to have Graham, my husband, and my mother, or whoever, so you go back to talking about how we manage things. How great is it to have an app that I can include everybody in, so they can see the appointment, they can see the notes, they can see the doctor's information. So when I say, Dad, can you take McLean to this appointment? He can have all the information for that appointment in there, as well as, or you go to an appointment, they say, well, what did the last x-ray look like? and you say, hold on, I have it here. So that's the whole idea behind Chronically Simple. And if I had that back then, right out of the gates, there'd be no binders. I wouldn't have had any binders. It would have been amazing. So it's something that I definitely, whether you have a diagnosis or not, I think about your, the NICU parents, even that first year, even if there's nothing wrong, there's a lot of follow-up, there's a lot of appointments. And so this is a great way to track all of that and keep it handy and share it as you need to.
Yes, and you have an offer for our families here that I'm so excited about it.
Yeah, so we'll share the details. Fabi's going to share the details in the Facebook group, but Chronically Simple would like to give complimentary subscriptions to the members of the Canadian Premature Babies Foundation in your group. So Fabi will post a code for that that'll be specific to your members, and they can go on and they can have access to Chronically Simple, and they can enjoy the app and see everything that it has to offer. And so I think it's great. I think it's a great opportunity, and I would encourage people to use it. And Christy isn't on the call today, but I know she's really excited to be able to offer this to your members, and I hope people take advantage of it. It's a great app, and it can just be very helpful.
Thank you, Brenda. We are so grateful for that. Really,
yeah, no worries.
It's amazing.
Happy to do it.
So there's a comment here for you. My parents still have emotional feelings about my preterm birth, even it's 40 years ago. It is a traumatic experience for both parents and preterm babies. Dear Brenda, I wish you all the strength. This is from Juliet from the Netherlands.
Oh, thank you. I appreciate that. It's very kind.
It is very kind, and Juliet has been doing amazing work in the Netherlands now that she's been bringing her own experience as a preemie to the research world right now.
Thank you, Juliet, because that's so important, right? It's like you said, 40 years later, and people are still dealing with what happened all those years ago. So the more we can do, the better.
Absolutely. Brenda, our time is almost up. I wanted to leave us with a last message for families who are watching us here today.
So I won't take too much time because I know our time is up, but I don't always take my own advice very well, but I would say, you know what, just be kind to yourself. We didn't ask for this. We never planned for this. I never read the last chapter of the Expecting Parent book. I never read the premature chapter. I didn't think I needed to. So, we never expected this. We didn't plan for it. There's no manual for it. No one can tell you what to do, how to feel, how to manage. We can give advice, but this is everybody's individual journey. Be kind. Don't feel guilty. You're doing what you can do. Do all that you can do. And if you can't do it all, that's okay. You shouldn't have to do it all. Ask for help when you need it. But just be kind to yourself, because, we're too hard on ourselves. And this is very emotional. These are our babies. This is very traumatic. So do the best that you can do. You're doing the best thing that you can, and just allow yourself that grace.
Absolutely. Brenda, you always have some, nice words to share with the families. And from my own experience of having a child with special needs, obviously this is not what I had planned in my life when I decided to become a mom. But nevertheless, we have a fulfilled life. And my son with cerebral palsy, with a lot of other complexities, he's the joy of our lives, and he brings us joy every day. So any diagnosis is not what we expected, but we can still live a wonderful life as a family and try to find the joy in the middle of this storm that we feel that we are in the beginning.
Absolutely. So true.
Yeah. Thank you, Brenda.
Thanks, Fabi. Anytime.
And thank you everyone for watching us here today. On Wednesday, Kate Robson is hosting a real-time peer support group at 1 p.m. Eastern Time. Kate is a psychotherapist and also a mom of 2 preemie girls. And you can join her group by joining the Canadian Preemie Parent Support Network, which is our private Facebook group. And all our Facebook Lives are recorded and available on our website with a variety of topics. And you can access on the CanadianPreemies.org. And Friday, I will be interviewing Dr. Michael Narvi, and he's going to be talking about bringing medical information to the public, to families. He's a great blogger, and I'll be having this discussion with him. How can we interpret research and make available to all of us? Thank you, and stay well.
Thanks, guys.